Hello, good evening, and welcome to Response to COVID-19. I'm Wesley Gibbings, and this is TTT Live, and we are joined by Talk City 91.1 FM and TTT Live Online. Among the several areas of concern arising out of the current pandemic, in light of the important actions being taken by governments worldwide to protect their citizens, is the plight of the economically vulnerable. The prospect of long periods of self-imposed and mandatory isolation is also presenting issues related to both physical and mental health. With us this evening to discuss these two issues are Minister of Social Development and Family Services, Honorable Camille Robinson-Regis, who will clarify a number of new initiatives announced earlier today. And she joins us on the phone a little later. But in studio, we have behavior change therapist, Wendell de Leon. Welcome to our coverage of COVID-19, Mr. de Leon.
Thank you, Wesley. Thank you.
How are you seeing things unfolding? This is uncharted territory for us in Trinidad and Tobago, certainly.
Oh, definitely. I think worldwide it is uncharted because we have not seen a pandemic of this magnitude to say that we would have all been touched in some regard. We might have seen smatterings of things, but now it is in our backyard, it isn't in our home. And the issue of being quarantined, the issue of being asked to stay home, as you said earlier, in some regards, some people have to leave their jobs. Children are sent home from school, they have to now be quarantined within the homes. That is huge for us. And with I was having a conversation with somebody earlier on today, and they said, we are a Lyman culture.
Yes.
and that in itself puts us in a place where new habits to be formed in such a quick space of time, it's challenging. And I do commend, like, again, jumping off of what you were saying earlier, the government putting a lot of initiatives to address the economic fallouts that is a big chunk of what is happening to, not just us, but again, internationally, against a recession and having this now limitation of manufacturing goods and items not being received. And we're going to have a lot of that. People can't move around. What we have to then look at is, with these initiatives being discussed and more or less brought in as policy or even with a level of intensity at this point, my concern, Wesley, is can people develop the habits to support these initiatives in the space of time required? And that is the concern for me.
Yeah, now, behaviorally, as you said, this runs counter to our culture. But we have had episodes in the past, albeit very brief periods, where you had states of emergency, for example, and curfews, and people responded in a certain kind of way. You saw that people were having curfew parties. But this is a slightly different scenario because now you're advised against assembling.
Yes.
So you're taking away the going out part of it, and now you're taking away the assembling part of the arrangement. How do you see that impacting on the psyche of Trinidadians and Tobagonians?
I think what is happening for that particularly, people are deliberately staying in a space of denial, not willing to accept the fact that the truth of it is we should not congregate, we should not have large assembly, gathering of any sort. And people are not willing to identify that it is for, as we say, their own good. It is for the best interest of not just you, the person, because when you adhere to the call to not assembly, to not go to the bars, to not increase the risk of transfer, you are then thinking bigger than yourself. You're thinking for the rest of the society, the rest of the country. When you fail to do that, because as far as you're concerned, why should I have to? Why am I holding myself at bay and at going home? And for some people, it's a difficult thing, Wesley. So I guess we need to talk a little bit about that. The fact that people have been avoiding and using getting out of the house as in a way of avoiding dealing with a lot of interpersonal issues and a lot of family issues that they may not wish to deal with or they may not have the resources to deal with. And so working late hours are avoidant ways of dealing with it. Not the best way in terms of healthy coping. So what we now have to look at, when you force people who don't want to be in the same space to have to be in that space, we run the risk of other things happening. We run the risk of domestic violence increasing, and therefore, because 14 days can be a long time to be with somebody you don't really want to be around.
14 days in the first instance, some
Yes.
people are saying that this thing can go much longer.
Oh, yes. And I mean, I foresee that with some of those callous and insensitive response, and I say it insensitive because I think people are not looking at the bigger picture, we run the risk of seeing a lot more cases emerging and coming out of the woodworks, and possible casualties as well that can now affect how we do business significantly. Possibly the government might then have to determine that we have to add the pressure on by increasing, bringing on a state of emergency or something like that to ensure that people are forced to stay in their indoors and stay in their homes. And when that happens, of course, it does not. This is not the 1990 coup and one of those things where, as you say, we have coup parties and all those things now. Having any gathering is a risk.
Yeah, and well, that's an entirely different field of play. And perhaps when the minister comes on, you can talk about the official interventions that might be needed to address the problems that would arise. Now, one of the other things that's happening now is that these children who are at home. Now, I have a few friends who I follow on social media, and there's one friend, for example, who was saying, this is day 3 of isolation and homeschooling.
Homeschooling.
2 children. One has already been suspended and the other one expelled. That's the end of that. So you find that there are coping mechanisms there that people are not necessarily equipped to deal with. And so you add to the other interpersonal areas of stress the fact now that you have these children, and then perhaps you might see different kinds of behaviors that are not in the best interest of children emerging. How do you see that unfolding?
Well, see, let's look at the positive. We are seeing a new way of a new approach to education now at the primary school level, which is interesting, and even at the secondary school level,
yes,
where now technology has been introduced significantly to reach the children in their home. So it is not that the education has ceased and the children are just at home left to their own devices. The challenge, however, is for those that are primary school based, that they would need a level of supervision. And I guess this is where the government looked at parents staying home, at least one parent being there to supervise those children and ensure that they can be able to adequately do the work required of them, online, that would be placed in front of them, and that they can stay to do the work. So it is a new area, we have to cover a lot of ground. I mean, I'm saying new in that for that level of children, in terms of some schools already would have had it set up, so it now being activated and being used. And because I can say for even my children, their primary school, they automatically, the amount of work that's coming in now from that online platform is phenomenal. Of course, the challenge, like we have SCA, children who have been preparing for SCA, what is going to happen to them? How are they dealing with it? Where they would have, as you said earlier offline, when we were having that chatter about how do they're peaking and their level of readiness for it, and then now they're required to pull it back till May. And I mean, sensibly, yes, because with all the other instability that's happening in front of them, it's going to be difficult. Even if it is they wanted to do it in April, it would not have been practical. So pushing it back is one thing, but how do we now prepare the children to not feel the level of anxiety that could come from, oh my God, when will this thing be over? Is it ever going to end? And they are now at home, but they're not really relaxing because they're still, and where do you put the boundaries? Do you have a 5-day week, or is it now a 6 or 7 day week?
Well, you see, and for sure what has happened, and I've been looking at the positive and negative legacies, as I'm calling them, what would be the leftover from this when we eventually get through this? One of the things I'm seeing is a new appreciation for the value of teachers. Yeah. I saw one parent post on social media that I recommend a $1 million pay increase for teachers, particularly at the primary level.
Oh, they have been doing, a phenomenal piece of work in terms of teachers. We also have to look again, at not just the disruption, but at the speed at which some of those schools have been able to readjust to get the children back into some kind of seamless form of education and teaching and lessons and the plans that are coming out. So it also means that some of those teachers are running it back to back overnight,
sure,
just to prepare and to facilitate the online platform.
And their parents too.
Yeah.
And also caregivers for elderly parents and vulnerable
And they are
people.
dealing with the whole issue of COVID. And as we're talking about the elderly, as you mentioned, I think we have to be very, very concerned. They are part of the vulnerable group. And I think that we need to look at how we have a lot of elderly care home in Trinidad and Tobago right now. And what are we putting in place to make sure that those homes, just like you said, again, some of the offline chatter, really look at the protocols established for hospitals. What are the protocols that they are mandated to follow to make sure that those people are safe? Because one person being infected in one of those homes can lead to a number of issues inside of that, and we can have casualties coming out of that, because those simple things as one person being diabetic, and we have immunocompromised being, a number of things can be that. You could have diabetes, you could have anything that then would interrupt the body's ability to defend itself, or the body's ability to create enough white blood cell to protect itself. And so issues of even stress that can play a part in how people are dealing with it. So people may think that immunocompromise is just having one of those stated illnesses, but the higher levels of stress that your body can no longer protect itself can render you also in one of those vulnerable groupings.
Okay, I want you to give some free professional advice to people who are another group that I've noticed. And these are people who are otherwise well-adjusted. They don't have physical or emotional problems of significance, but they've become obsessed with COVID-19. So these are the people who they're on social media.
Panic buyers.
Well, they were the panic buyers, but they're also sharing information. They're not necessarily being very prudent with respect to the information that they're coming across and sharing. And they're constant, and there's this obsession. And what I see the danger of unfolding is a high level of paranoia and fear and anxiety. So that they in turn might become another group of people that we have to keep a close eye on.
But it's strange that when we mentioned trauma earlier. The issue of trauma, one of the fallouts of it is hypervigilance, and we are seeing hypervigilance playing itself out significantly throughout our society, in terms of people over-exaggerating some of the behavior. People are not even practicing proper safety. You see people wearing gloves, but they're not, in terms of the health, the proper way of better to don and doff, the taking it off and putting it back on. They're still risking themselves. And I am saying, if you are heightening and continue to let that hypervigilance feed into the social media platform and creating more anxiety for others, let's be responsible.
Okay, we have to leave it there because we're going to go to a break. But we definitely need to come back to that, because we have the phenomenon of the epidemic or the pandemic, and we have the phenomenon of the infodemic, which is the information overload. So we'll be right back to take that issue up.
The winning numbers in the National Lottery online draws for Wednesday, 18th March 2020. At 10:30 a.m., play away the number 2 Old Lady. Pick 2, numbers 25 and 30 in that order. Pick 4, numbers 8, 1, 3, and 7 in that order. At 1 p.m., play away the number 27 Little Snake. Mega Ball called. Pick 2, numbers 34 and 30 in that order. Pick 4, numbers 4, 0, 5, and 0 in that order. At 4 p.m., play away the number 24 Queen. Mega Extreme Ball called. Pick 2, numbers 14 and 13 in that order. Pick 4, numbers 2, 3, 7, and 0 in that order. At 7 p.m., play away the number 16 Jamet. Pick 2, numbers 34 and 21 in that order. Mega Ball called. Pick 4, numbers 0, 7, 0, and 5 in that order. Cashbot numbers 15, 16, 4, 20, and 10 in any order. multiplier 1.
If you are a parent, chances are you're worried and have questions about just how contagious coronavirus is and whether your child could be at risk. Misinformation has cropped up across the internet since coronavirus, or COVID-19 as it's now called, began spreading. So we asked UNICEF's health experts to get us the facts. Here are 6 things they think you should know. The virus is transmitted through direct contact with respiratory droplets from an infected person and by touching surfaces that are contaminated. Tell your children to maintain at least 3 feet of distance between themselves and people who are coughing, sneezing, and have a fever. Symptoms of coronavirus can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal, but that's mainly among older people with pre-existing conditions. Wash your hands frequently for at least 20 seconds using soap and water or an alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. Use your elbow, like this, or use a tissue and then throw it in the bin immediately after. Not really. If you don't have any symptoms, there is no need to wear a mask. Hand washing is actually more important. If you're coughing or sneezing, it's advised that you wear a medical mask to help protect others. For now, there isn't enough evidence to support whether the virus is transmitted from a mother to her baby during pregnancy or what impact this might have on the baby. To date, there is no specific medicine to prevent or treat the new coronavirus. So the best thing you can do is practice basic hygiene. To learn more, follow UNICEF and the World Health Organization for the latest updates.
Welcome back to Response to COVID-19. I am Wesley Gibbings in studio with Wendell De Leon, who's a behavior change therapist. And we have on the line now the Minister of Social Development and Family Services, Honorable Camille Robinson-Regis. But before we bring her live online, let's take in this clip based on her contribution to a press conference earlier today.
Social Development Minister Camille Robinson-Regis said a Social Support and Job Preservation Committee on COVID-19. The committee examined the most vulnerable in communities and those who would suffer the fate of a reduction in income. She made the announcement while speaking to the media during a briefing after a special cabinet meeting on Wednesday. Mrs. Robinson-Regis said people who receive help through the TT Food Card would receive a top-up.
We will provide income support for a period not exceeding 3 months under the Public Assistance Grant. And where there are children under 18 years, these children will be considered necessitous, and the grant may be extended for a further period, but not exceeding 3 months.
She said the committee recognized that there are children who benefit from the social feeding program and would ensure this continues.
So in those circumstances, we will now bring those persons onto the food card system in order for us to ensure that the nutritional needs of those children are maintained.
She also announced increases to rental assistance.
We are in the process of establishing a policy for an initial period of 3 months, but no more than 6 months for households where a wage earner was retrenched, terminated, or there has become a reduced salary.
She said government would provide financial support to people who are retrenched or terminated as a result of the COVID-19 pandemic. Sherilyn Lewis, TTT News.
That report based on the presentation of the Minister of Social Development and Family Services, Honorable Camille Robinson-Regis, at a press conference earlier today. And we do have the Minister live online. Welcome to the program, Minister.
Thank you very kind. Here, and I'm happy to have been asked to participate.
Yes. Well, what you're finding is that there have been a lot of positive responses to what was initiated today, and I think you probably feel very proud of yourself for getting the Minister of Finance to agree to this, particularly at this time.
Yes, well, it's not so much a matter of pride, but it's a matter of necessity, and I'm happy that my cabinet colleagues agreed to what this committee determined would be in the best interest of those most vulnerable in Trinidad and Tobago, because it's important for us to keep our most vulnerable whole. So I am very pleased that my cabinet colleagues agreed with the team's approach that we took, and I want to thank the members of the team who worked with me on this.
Now, I'm in the studio with behavior change therapist Wendell de Leon, and before we came to you, we were discussing perhaps one of the unstated so far elements of this challenge that we're facing. There's certainly the financial situation, and that is being by and large addressed through some of the measures that you announced today. But there are the issues related to what Mr. De Leon has described as the emotional trauma of what people are undergoing now. What is envisaged by way of addressing that need?
Well, in the Ministry of Social Development and Family Services, as our name suggests, we have recognized that there will be a need for some psychosocial support. And we have determined that we probably have to put in place some more call centers in order for people to be able to call in and get that support. We have had an offer of assistance from some NGOs who deal with this kind of trauma, as you call it, and we recognize that it is a very real possibility. One of the other things that we have been talking about is dealing with the elderly, who may feel some sense of distancing from family members or persons who would normally come and see them. And we feel we have to deal very carefully with the elderly in our society. And in fact, with families, because there can be some disruption to what might be the norm in family interactions, but it also gives a great opportunity for families to do things together. And that is going to be an area that we will be emphasizing as we speak to the people of Trinidad and Tobago.
It's great. I'm really happy to hear and see what has been taking place so far. Very forward thinking by the government, some of the initiatives. I would like to add to some of that there's a need. Early on, we spoke about the elderly and some of the elderly care homes, and that there's a need to have some level of protocols in place to make sure that their well-being are at utmost priority.
Yes,
what I would like to see, Madam Minister, is that where it is to the employee assistance program, since some workers are asked to stay home, especially to deal with their children and to address, so they're taken off the job market for good reasons and good measure. And we have the whole issue of pandemic leave and all of that. If we can then allow them to get the support via, if it is that it's call-in platforms that need to be set up, but that they can be, their anxiety, their grief, their trauma, if we get to the point of having casualties, can be addressed in an effective and a timely manner as well.
But I'm not sure exactly what you mean. Could you explain?
Okay, without casualties now, we need to take the time, the little hiatus that is afforded to us to be able to put in place employee assistance programs or EAPs or let's say, counseling or therapy for persons who may be at home, who may be experiencing anxiety, who may be dealing with the trauma of potentially losing their job or losing their income, their earning, not knowing where to turn to at this point in time. And how can we support those persons even at their homes, even some of them who actually had to deal with children and not having the experience. And we don't want abuses to take place. We don't want domestic violence to increase because some people have avoided being in the home. And because of that avoidance, you may have a reduction in domestic violence, but now they're facing each other in the homes. There is a need to assist those families who are struggling, hence the need for that kind of intervention to be made accessible through call-in centers, as you spoke about earlier.
Yeah, that is why I said that we have been examining the number of call-in, existing call-in centers and services that we have in the government, and we will be increasing those numbers so that we can make that kind of assistance.
Excellent.
And we have had offers from NGOs and the private sector to provide additional resources as necessary to facilitate call-in services to the population. We recognize that what you have just said is a real possibility, and we do not want anything to escalate beyond what might prove difficult for any family to manage. So we want to make sure that we have things in place at the earliest, and we've been doing that. We will not be caught flat-footed.
Yeah, but Mr. De Leon moved away from a point he started making with respect to what I think he was proposing with the increased policing of private institutions that deal with the elderly, because I think things will be probably be very well handled at the public health institutions, where visitation rights are visits are being limited and so on. But with those private institutions, there'll probably be the need for increased vigilance. Are there things being put in place for that?
We do have an NGO unit at the Ministry of Social Development and Family Services, and that unit has been acting very commendably. And I'm sure in the circumstances, they will be making those unannounced visits more frequently. And we have also sent out to those homes different posters and so on to remind them of what they need to do to make sure that the elderly is well taken care of, especially during this period.
Now, the homeless comprise another area of concern, and I know it did not go unaddressed this afternoon. But what are some of the specific needs you see emerging out of that group of people?
I think one of the things is that we have to get them to move along, as we call it, because we do have that policy in place. As you know, we do not have the legislation in place because there's this concern that it's their human rights to be allowed to stay on the street. Some years ago, that was argued. But what we do have in place is a unit that tries to persuade people to come off the streets. We do have the Center for Socially Displaced Persons, and we work with the St. Vincent de Paul Society. And we also have other NGOs that will work with socially displaced persons. And what we have asked, and Cabinet has agreed, is that an additional subvention be given to these NGOs that will deal with the socially displaced, to allow them to provide meals for additional people, because we anticipate that in conjunction with the requisite services, the Ministry of Health, the Ministry of National Security, that we will be able to get these people to move off the streets and into these centers where they will find the requisite sustenance that they need.
I think
that is our intention.
Successive research in this area has shown that you're dealing with a high incidence of mental illness among these people. How is that being taken into consideration?
Well, as I said, we will be working with the Ministry of Health in dealing with these people.
Okay, another group.
And that is certainly an area that what we have found is that it's approximately just over 30% of them who may be suffering from mental illness. And as a consequence of that, we have enlisted the support Ministry of Health in this regard.
Okay, and another group that we need to pay attention to are the disabled and the provisions in place for them. What is there for them?
Well, with regard to the disability grant, we will be those persons who, if there is one person who now receives a disability grant, that will be topped up by $150, and that will cover 12,960 persons. In the case of children who receive disability assistance grants, they will be also getting a top-up, and that will cover 1,056 children. For families who are receiving public assistance and disability assistance, there's also the topping up in terms of families for public assistance, where there are two persons in the family, they'll be receiving a top-up of $300, and that will cover 3,415 persons. Where there are three persons, the top-up is in the order of $450, and that will cover 1,294 persons. And where there are four or more persons, the top-up will be in the order of $500, and that will cover 752 persons. So we have tried, in this committee, we have tried to look at all the vulnerable groups. So it includes persons who are receiving public assistance, persons who are on the food card system, persons who receive the disability assistance grant, and also those children who now receive the school feeding, so who are now part of the school feeding program. We will also be ensuring that their nutritional needs are not left wanting at this time by ensuring that their parents get a food card if they're not already on that system.
Some of these interventions, perhaps not those that you have listed there, but certainly I would say the short-term relief for people who lose employment as a result of COVID-19 would require a level of bureaucracy to bring them into the system and to ensure that you're dealing with a straightforward situation. Are there ways that you're going to be fast-tracking the bureaucracy?
Our intention is to fast-track it, and in addition to that, the persons who do apply at this time will have to adhere to a statutory declaration, and in accordance with the Statutory Declarations Act, they can be charged if they do not tell the truth. So we are going to fast-track it, but we will also try to cover ourselves by ensuring that they adhere to a statutory declaration.
Okay, Minister, well, we have to leave it there. I want to thank you very much, Minister of Social Development and Family Services.
You're very welcome.
All the very best.
Thanks.
Great.
Leon, thank you very much for the work that you're doing for Trinidad and Tobago. God bless you. Thank you.
You're most welcome.
Okay, bye-bye.
Thank you, Minister.
You're welcome.
Now, at this stage, we want to go elsewhere in the region, and we're going to take a break, and when we come back, we're going to take a report from Jamaica, which only a short while ago registered its first COVID-19 death. We'll be right back.
Can I get coronavirus from a package sent from China or other countries reporting cases of the virus?
No, the new coronavirus cannot be transmitted through goods manufactured in China or any country reporting COVID-19 cases. According to the World Health Organization, even though the new coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface, it is very unlikely that the virus will persist on a surface after being moved, traveled, and exposed to different conditions and temperatures.
This public service announcement was brought to you by TTT Limited Media Network.
When pain feels this tough, choose Panadol Ultra. Fights 5 types of tough pain, including migraine headache. Panadol Ultra. When pain is gone, life takes its place.
Protect yourself from COVID-19 novel coronavirus. Thoroughly cooked meat and eggs. Healthy me, healthy you, healthy Trinidad and Tobago. A message from the Ministry of Health.
Welcome back to Response to COVID-19 on TTT Live online, and Talk City 91.1 FM. At this stage, we're going to shift the focus to Jamaica, where the first COVID-19 death occurred earlier today. And we have on the line Damien Mitchell, who is from the RJR Gleaner Group. Damien, welcome to the program.
Hi, thank you.
Well, the first death has been registered, but we know that the minister and the cabinet has been very busy in terms of putting things in place for what has confronted the nation. What's the very latest with respect to the arrangements being made to address the situation of COVID-19, and how was news of the first death greeted by Jamaicans?
Well, let me begin with your second question. It has been a shock for many Jamaicans. The level of preparation has been really intense. Certainly business entities, private sector companies, that is, as well as public sector entities, and individuals have been seeking to prepare themselves, purchasing sanitizers, alcohol, etc. Several companies have instituted new measures, new protocols in respect of visitors. But in the community of quarantine settlement in Clarendon, southern Clarendon, where this patient was from, I was just speaking with someone a while ago who was just telling me that panic has really cramped the entire community. This patient was 79 years old. He was predisposed, of course, because he had diabetes and hypertension. And as a consequence, he would have been more vulnerable to the vagaries of this COVID-19. He died this afternoon around 3 o'clock.
Was he an imported case, or is this something that started in Jamaica?
He was an imported case. He returned only recently from New York, and he developed symptoms consistent with COVID. He was admitted to hospital on the 16th. He was tested, and the results came back only, he was tested yesterday. And the results came back only today to confirm that he had the disease.
Before you came on, we had our Minister of Social Development on, and today a suite of interventions by the state, supportive mechanisms for the vulnerable, the disadvantaged, the disabled, and so on. That was announced. What's happening in Jamaica with respect to the treatment of the vulnerable through this time?
Yes, the Minister of Finance was in the Parliament just a couple of days ago too, and several measures have been announced in respect of the vulnerable. Stimulus packages have also been announced for some businesses who will need some support. Just today we were reporting that 1,000 hotel workers are expected to lose their jobs come tomorrow when their hotels close down. Some of those people who are working in the hotels certainly would be a part of the lower sector of the society who would be depending now on government assistance. So the finance minister has announced that our program of advancement through health and education, which really targets the most vulnerable, will be buttressed, and support packages are being distributed, for example, to people in Bull Bay, St. Andrew, which is regarded as the first area of quarantine. So all 15,000 or so people in those areas are unable to leave their community because they are under active quarantine. That is the area where the first patient, we call her patient 1, is from. And as a consequence, she would have made several contacts with people at a funeral for which she had arrived in Jamaica from the United Kingdom. And as a consequence, that area is now under quarantine. So packages, that's relief packages, are also being sent to them.
I think Trinidadians and Tobagonians
on a wider scale.
Yeah, need to hear this. Damien, before you move away from that situation in St. Andrew, is that I'm not sure whether Trinidadians are aware that this is an entire community comprising how many people?
Around 15,000 people.
About 15,000 people who are now under lockdown. And I think that people who have not been getting the message here will get it when they realize that this came about because I think it was the first 2 cases that were detected.
Actually, the first case.
Yeah,
the first case of that patient who came to Jamaica around March 4 for a funeral on the 7th of March, and she was discovered to have the coronavirus. She came from the United Kingdom, and immediately after it was found that she had the virus, the government shortly after moved to institute a quarantine area in the 7 and 8 miles area where she would have made several contacts. In fact, just today we're learning that of the 15 cases, this is new information, that we now have 15 cases up from 13. Of the 15 cases in Jamaica, 5 of them have been connected to patient 1. So, including patient 1, 6 cases are accounted for with the contacts made by her. Herself being number 1, and 5 others would have contracted the virus, having been in contact with her.
Now, even though you've had this, are you finding that Jamaicans are getting the message that this is serious business and that their behavior need to change?
Without a doubt, it has been reaching. And just about yesterday or so, you were sensing a tad bit of complacency with the fact that the numbers have been pretty stable, because we are just about a week now into the discovery and we're at 15 cases. Having had several of the cases, I beg your pardon, that was maybe about another 10 of the cases so far confirmed being imported cases. Having had that, what you had were people becoming a little bit, just a tad bit complacent. But with this evening, certainly the level of attention has ratcheted up right up there, and as a consequence, you are feeling again some amount of panic and a reinforcement of the measures that had already been taken to contain the spread of the virus. There's one other point I must make quickly, and that has to do with what's happening with businesses, particularly corner shops and supermarkets. The government has instituted measures banning all public gatherings of more than 20 people. It has also announced that all work that may be carried out from home in private and public institutions must be carried out from home. And the permanent secretaries have a duty in the ministries to determine who can work from home, and the business operators have a duty to determine who can work from home. And in fact, just yesterday, the Prime Minister made that order in the Parliament. It is now gazetted as the law, which means that it is an offence if you do have people working where it can be proven that their functions could be carried out from home. It's a part of the measures to seek to contain people and to have them remain at home.
Yeah, Damien, we have to leave it there. I want to thank you very, very much. Wish you all the best. I know it's very difficult times there. Damien Mitchell of the RJR Gleaner Group in Jamaica. So, you've heard of Jamaica and the trauma, the element of trauma. Can you imagine a community of 15,000 people on lockdown?
Not just that. Prior to that, he's also saying that most of the hotel, the staff of the hotel industry would have been sent home. And basically hotels are closing down because no business happening. So the country is coming to a grinding halt. Similarly to what is happening in Trinidad and Tobago at this point in time, we have come to a grinding halt. There is very little or little to no business taking place. In some places, like I just strolling through and looking, you see a barber, his barber shop is closed, basically it's nothing to do. The taxi drivers are going to be up and down, nothing really happening for them. So with that kind of thing, we realize that we are not different from what is happening to our neighbors. The only thing now that our neighbors they are at the point where they have now experienced their first death. And I think the complacency that we too have been experiencing,
that has to come to an end.
And that is what I think particularly we want to send that message home.
We have to wrap now. I mean, there's so much to explore. We need to bring you back another time to continue the discussion, because a huge part of this story has to do with what's happening to people in psychologically, mentally, and their coping mechanisms. I'm Wesley Gibbings saying thank you very much for joining us this evening, and we'll see you again tomorrow. In the meantime, stay safe.